Hello and welcome everyone to our webinar Navigating State and Local Resources. So we invite you to please say hello in the chat and let us know what district or agency you are from. We always love to see that so many people across the state are joining us for this series. My name is Yesenia Ayala, and I'm part of the WestEd team, and I'll be providing some framing for today's session. So today's webinar is presented by the Oregon Department of Education and WestEd. A couple of housekeeping items. So during the session, participants will remain muted with their videos off, but you are invited to engage with us by sharing your comments via the chat. Also, please feel free to submit questions for our presenters via the Q&A feature. And just as a reminder, this session will be recorded and posted in ODE's K-12 Substance Use Prevention and Intervention webpage and to ODE's YouTube page. And lastly, there are two links you will find in the chat. So the first is to the slide deck, and the second link is to the link tree that includes all of the resources we will be referencing today. And that is the QR code you also see on the screen. Now, we have 60 minutes together today, and our session objective is to highlight and discuss existing general school, local, and statewide resources from ODE, the Oregon Health Authority, and other state-funded resources. So our agenda for today, we'll start with some welcomes and introductions. We will have a section on what are the tiers of support in Oregon. We'll talk about Oregon's general school, local, and statewide resources. We'll share some key, we'll have a section on key statewide organization, Oregon Health Authority, and then we'll have a questions and answers with two incredible guest speakers today. We do want to make sure that we share that this webinar will cover sensitive topics related to opioid misuse prevention, the trauma associated with the opioid epidemic, and its impact on students in the state of Oregon. We do want to emphasize that the discussion aims to equip educators with effective planning strategies and emphasizing the importance of inclusive and non-shaming language. And lastly, our goal really is to create a respectful, supportive environment for learning and collaboration. And again, some content may evoke strong emotions or discomfort. So we invite participants to please take care of their well-being. And if you have any concerns or need support, please let us know during or after the session. So at this moment now, I will pass it over to Alana Russell from the Oregon Department of Education.
Hi, everybody. My name is Alana Russell, and I am the Substance Use Prevention Education Coordinator with the Oregon Department of Education. At ODE, we serve over 560,000 students across 197 school districts. And our mission is to foster equity and excellence for every learner through collaboration with educators, partners, and community. Specifically, my role at ODE is to provide technical assistance and support for school districts related to substance use prevention and intervention, as well as serve as a state-level point of contact and liaison for school substance use prevention work. As part of this work, I've been fortunate to collaborate with WestEd to develop this learning series, as well as a suite of other resources that we will talk about across these sessions, as well as will be available on the ODE webpage in the coming months. I'm really grateful to be joined by you all. If you have questions after today's session, or you would like to collaborate or discuss things further, you will be provided my contact information. I really encourage folks to reach out to me. I love meeting with people and talking through ideas or questions that you have. You may also use that email to reach out to me if you would like to receive professional development units for your participation here today. And I have the privilege of introducing our two guest speakers and panelists. The first person to be joining us is Courtney Fultonier, and you'll hear from her later. But Courtney is the Overdose Prevention Program Manager for Oregon Health Authority's Injury and Violence Prevention Program. She serves as Principal Investigator for OHA's Overdose Data to Action and States Grant from the Centers for Disease Control and Prevention. Courtney also supports the Oregon Opioid Settlement Prevention, Treatment, and Recovery Board and administers the board's funding allocations. And our second speaker is Alexandra LaFake. Alexander is the Overdose Prevention Coordinator for Lane County Public Health. He received his Master in Public Health from Portland State University. He coordinates overdose prevention strategies and engages the community in education, prevention, and harm reduction. He developed and coordinated Fentanyl Aware, a localized campaign that aims to increase awareness, reduce stigma, and spark conversation about drug issues. And with that, I will pass it to my WestEd partner, Derek Lowry.
Thank you, Alana. So I am going to introduce the WestEd team. So my name is Derek Lowry. I'm a Senior Justice Technical Assistant Specialist and a Senior Program Manager at WestEd. And then my two colleagues here, Dr. Loeffler Kobia is the Director of Justice and Public Health Policy and Practice at WestEd, and Colleen Carter, who is a Research Associate and will be also speaking on this webinar. So WestEd is a nonprofit research development and service agency. We are dedicated to improving education, health, and human development outcomes for children, youth, and adults. We focus on research and evaluation, professional development, and also providing technical assistance to various states and partners. We support schools, districts, states, local governing bodies, and local and national organizations in implementing effective strategies across various programming. And our key focus areas include education, health, and well-being, and improved outcomes. So at this point, I am going to facilitate a fact or myth activity with everybody. So I'm going to read a statement, and then we're going to poll you all. So please select whether or not you think the statement is a fact or a myth. So is this fact or myth? Every school in Oregon has a school-based health center. Please take a moment to select myth or fact on the poll. Okay, I think we can end the poll and share the results. So 91% selected myth. This is a myth. Not all schools in Oregon have a school-based health center, and there are lots of reasons for this, including funding, need and demand in the school, space and facilities, and then whether there are even enough resources, infrastructure, or available partners. So the second fact or myth question, the Oregon Health Authority provides naloxone, a medication that rapidly reverses opioid overdoses, to schools and community organizations for free. Do you all think that this is a myth or a fact? There's a lot of confidence coming in terms of the answers. Let's go ahead and end the poll and share the results. So 86% thought that this is a fact, and this is a fact. The Oregon Health Authority does provide naloxone or Narcan to increase accessibility and help prevent overdose deaths among residents in Oregon for opioids. At this point, I am going to pass it off to Colleen Carter.
Great. Thank you so much, Derek. As we navigate state and local resources, there's 3 different tiers of support in Oregon that you need to know about. So you have your supports across the state. You also have supports that are offered by local service providers, nonprofits, and community-based organizations. We'll talk a little bit more about that in a future slide. And then supports and resources in the school districts within your schools. And so what's really important is that school professionals play a pivotal role in being that first contact when young people are seeking and using supports across Oregon. We talked about this in our previous webinar, where school professionals can include everything from teachers, your school staff, principals, psychologists, coaches. And being that first contact, your school professionals are really helpful in disseminating information for both opioid prevention across the state, also help encouraging students and families to use state and local resources in opioid prevention, and also helping to promote the school-based opioid prevention resources that are available within your own districts, and learning also from other districts as well. So now let's talk a little bit about Oregon's general school resources within the districts, and then also the local and statewide resources. There is a lot of information, so we want to be able to provide you with as many resources as possible so that you can help support young people in the schools and communities. So there's 6 listed here. You have your health education curriculums, you have student support staff, also peer-to-peer support programs, community collaboration referrals within your district, and crisis intervention resources along with prevention training. So now I want to get into a little bit more of some really great notable resources we have. So Oregon school-based health centers, these are medical clinics that offer full range of resources from physical, behavioral, and preventative health services. And the link tree was mentioned earlier. There's a reference in your chat for a link tree with all these resources in it, so you can access these in your own time. But there's a wonderful map that shows the different counties and the different counties, and then it shows where these school-based health centers are located in whether it's in high school, middle school, or elementary school. And then the other thing I wanted to touch on was we've talked about this in the second webinar we did, recovery high schools. There's actually 3 recovery high schools in Oregon. They're Harmony Academy, Rivercrest, and Discovery Academy. And these are located within one of them is in the Lake Oswego School District. But the importance of that is it helps for students to be able to not just focus on their recovery and have that support system, but also being able to finish their schooling. And then last but not least, we have addiction counselors and specialists. These are trained specialists that are available in the county. And one of the links there, SAMHSA is a really wonderful organization. There's a lot of information you can find there about finding local counselors and therapists within your area or your district. And so now let's talk a little bit about the local resources. So you have Song for Charlie, which has peer-to-peer mentoring and support for teens and also education about fake pills. You have the Oregon Alliance, which is a wonderful nonprofit member organization that looks at behavioral health and social services organization that serves youth, children, and families across Oregon. They're a really great advocate and champion for youth. And then last but not least, we also have, there was one other one I wanted to mention, Recovery Network of Oregon. And so then let's get to our next slide. We have a few more local resources. So under school districts, you have your Know the Risk, which is in Oregon City District, and then Fentanyl Awareness in Beaverton School District. And then for community health providers, we have Friends Fight Fentanyl, which is located within Yamhill, Marion, and Polk counties. And then also Aware, Prepared, and Alive in Douglas, Coos, and hopefully I pronounced that right, and Curry counties. And then last but not least, we have Fentanyl Aware. So I am going to hand this off now to one of our 2 wonderful guest speakers, Alexander LeVake, who coordinates a youth and school-based campaign called Fentanyl Aware in Lake County. So I'll hand it over to you.
Thanks, Colleen, and hi, everybody. I'm going to talk a little bit about our campaign meant for schools and communities that came out of Lane County. In 2023, we realized a public health message was needed to increase knowledge of the issue, especially in settings where talking about drugs might have barriers, and we realized a public health voice could encourage conversation. So we designed a campaign called Fentanyl Aware in order to provide schools and the communities around them and supporting of them of an informative, non-fear-based framework for talking about fentanyl and preventing overdoses. This included our own social media channels on most major platforms, and here you're looking at some example posts used in our campaign. We strived to create a brand that stood out from typical government health messaging. Along the way, we ran paid campaigns on platforms like Meta and TikTok, aiming to meet young people where they're at, and you're seeing some examples of that here. We provided professionally printed print materials to all our partners, like the posters you see here, which came in various sizes in English and Spanish. And the biggest hit, of course, is always stickers. And you're seeing here our Narcan Saves Lives stickers, as well as postcards that were made for places like school counselor offices and doctor's offices, and places where folks can take something kind of small with a QR code to link them to our product, our fentanylaware.com website. Also, schools were provided a toolkit to implement their own way And this included things like ready-made newsletters, social media posts, classroom presentations. And so what you're seeing here are examples of our classroom-ready lesson for students. So thanks. I'm going to pass this over to Courtney, my partner at the state.
Yeah, thanks, Alexander. Hi, everybody. Thanks for joining today. It's always fun being in meetings with Alexander when he's talking about the Fentanyl Aware campaign because I like to, oh, you can't see it. I have a sticker on my water bottle for the Narcan Saves Lives. So it's always fun to be able to support our partners and help showcase their work in other spaces. But anyway, let me get on with the presentation. Courtney Fultonier with Oregon Health Authority, and I'm going to talk about some of our resources at OHA. So yeah, to just kind of kick things off, I think that it's really important to just understand and appreciate the fact that the overdose crisis that we're in right now is extremely complex. It's been a long time in the making related to a lot of really complicated societal and political factors. And kind of because of that, there is no really like one single solution that one agency can implement to help combat the overdose crisis. It's something that we at OHA really see as needing to be a collaborative effort across agencies, across sectors. And so kind of in that spirit, we are implementing a broad array of programs to help address the crisis in Oregon. And this slide highlights just some of the strategies, some of many strategies that we're implementing at OHA. The first being improving access to both overdose and substance use related data for both of our partners that are working in the overdose space, but also sharing this information with the public so everybody is informed on the trends as they are evolving. The next being improving local capacity to prevent overdose, particularly among communities that we know have been disproportionately by substance use and substance use related harms. We consider those to be our priority populations. We are also working to strengthen and expand our partnerships to include that cross-sector and cross-system coordination and collaboration. And then finally, working to improve access to information and resources. And this can include public communications, as Alexander just shared, and also can include actual supplies and harm reduction resources as well. I think that the one commonality among these different strategies is that they are all really grounded in our values of collaboration, of using really community-driven and culturally informed approaches to help reduce overdoses, but then also reduce the stigma that is associated with substance use and overdose, and also advance equity. So we do recognize that youth is a very unique population that really requires very specific and very different and tailored approaches than adult populations. It can't just be a one size fits all for any community, including youth. And so there are a large number of youth-focused strategies that are currently ongoing in Oregon. And really, when we think about our approaches, we really try to implement approaches across what's called the substance use continuum that ranges from preventing substance use, but then also reducing harms associated with substance use, and then kind of moving more into treatment and recovery approaches as well. Kind of in the spirit of knowing that we have to implement these tailored approaches to youth, kind of the first step is engaging youth, as Alexander mentioned, with his campaign, engaging youth, and that then also engaging youth to just kind of better understand where they're at and what are their attitudes and beliefs around substance use and overdose. So as a part of that, one effort that I will highlight is we just recently concluded work with an evaluation team to survey and interview over 900 youth and young adults. So this is spanning the age of 15 to 25 across Oregon to just kind of better understand what are their attitudes, what is their knowledge, what are their behaviors around fentanyl and counterfeit pills. And this has been incredibly informative for us to just kind of better understand how we need to tailor our strategies and maybe modify some of our strategies to best meet the needs of this population. Our agency also convenes a statewide youth advisory council to help support public health efforts. This isn't something that is specific to substance use, but substance use and kind of the co-occurring substance use and mental health issues is something that comes up pretty regularly in this group. And again, it's really helpful and informative to engage youth and ask them directly like what they need. So that is another really key and pivotal activity that we are implementing right now. I know that I saw that I was very pleasantly surprised to see how many folks in this group seem to be already knowledgeable around the Save Lives Oregon Clearinghouse, but I must mention it here. I'd be remiss if I didn't. But as we kind of went through in the fact or myth activity. The Clearinghouse does offer free overdose reversal kits to schools, also colleges, universities, and school-based health centers, and I will be talking about that more in a bit. And then finally, we do directly fund local prevention partners across all 36 counties in Oregon. I saw some folks that I recognize from that on the call today. It's great to see you all. And these prevention partners are working across the state to implement tailored and community-driven solutions to help prevent the initiation of substance use. I know I don't have a ton of time, but I did want to just kind of quickly highlight some resources that I think are most relevant and useful to you all. The first is our kind of newly improved overdose prevention dashboard. So this dashboard contains a statewide and county level information and includes data for both fatal and non-fatal overdoses. It's where you can go to access overdose trends. It includes information on specific drug types. It also includes demographics, which includes age, sex, race, and ethnicity. And you can also look at it and see county level trends as well. I think this resource is something, it's really helpful to kind of do that county level comparison. I know that this is probably really hard to see, but this is just kind of a screenshot of the dashboard and how you can look at different demographic trends. And so what you can see is you can kind of toggle between different categories. You can look at counts versus rates, and you can look at trends across years and just kind of look and see how those are evolving over time. And then this is just a snippet of how you can compare your county to other counties or other counties kind of surrounding you as well. Just kind of showing you the different factors that you can look at and the different metrics available. One thing that I will mention too is that information can be kind of limited sometimes on dashboards. And so if you are looking for specific data, we do have a team of epidemiologists available at OHA that are more than happy to help meet your data needs. And so if you are wanting to kind of get more granular information for your county, for example, that you're not seeing in the dashboard, please do reach out, and that's something that we can assist you with. The next resource that I'd like to highlight is a webpage on OHA. It's our local prevention partners webpage. And we really see this as a resource hub providing information and tools for our partners. The dashboard links that we were just sharing are on that webpage. It also has information about upcoming webinars and training and technical assistance sessions that our team is hosting, information about the local prevention partners and how you can connect with them. There's a wide range of fact sheets. We list our most recent data reports, and there's a ton of communications resources available as well. And then I don't know if you can see this because it is quite small, but there is a specific section on this webpage for youth-specific OHA initiatives that you can explore. And again, many of you are already aware of Save Lives Oregon, but this is a harm reduction initiative that is managed through our behavioral health division, and there's 3 distinct components to Save Lives Oregon. It includes harm reduction resources and materials, and so if you're curious and want to learn more about what is harm reduction and why is it important, you can go there. the kind of like most well-known component of Save Lives Oregon is the Harm Reduction Supply Clearinghouse. And then there is also a training and technical assistance component with the Learning Collaborative. I think that they're most widely known for the clearinghouse again, but this has been like a very highly utilized and very impactful initiative. And so organizations that are either serving or engaging with populations that are at risk of overdose can access harm reduction supplies, including naloxone, free of cost. And so it's a great resource. I encourage you to check it out. And then, as we've discussed before, schools are eligible to participate in the clearinghouse to receive naloxone. And one thing that I will highlight here, it's very small at the bottom, but you can see that as of March of 2025, over 665 schools in Oregon have received overdose reversal kits through the clearinghouse, and we are continuing to enroll schools in this program. And so please do check this out if your school is not enrolled and you're interested in enrolling. And then finally, the last resource that I'll highlight is the 2024 Fentanyl Toolkit for Schools. This was a collaboration between OHA, the Alcohol and Drug Policy Commission, and then also the Oregon Department of Education. It was really developed to support school administrators, school staff, and then also the broader community, so parents and loved ones of youth, to help them respond to opioid use among youth. So it provides information about fentanyl, resources, prevention, education, and then also guidance for developing school policies for stuff like storing naloxone and then also administering naloxone on school campuses. And then one thing that I would like to underscore with the toolkit is that it really does emphasize the importance of community partnerships and locally tailored messaging. And so Alexander's role, for example, Alexander's County is listed as a county to access, and we just really emphasize that those county partners are really important and they're available to help your schools in implementing prevention strategies. These are just the links to the resources that I just shared. And with that, I will pass it over to Derek.
Thank you, Courtney.
Wait, I'm doing a share out. I forgot about that. My apologies. So for the share out, we are wondering, does your school or organization work with local providers? If so, share who they are in the chat.
And I see that some of you are actually dropping some questions in the chat, so please feel free to continue if you have questions for Courtney and Alexander. You can start dropping those in the Q&A section or in the chat now as well, and we're going to collect those. And if any of you work with any community partners, feel free to drop those in the chat as well, or if you know that your school is working with a community-based organization. Looks like Lincoln County Public Health, they are working with multiple schools. Oh, cool. So several of you actually do work with different community partners on initiatives. That's wonderful to see. So as you're doing that, I think maybe because of time, we should transition to the Q&A. Thank you. So this is going to be a question and answer section with Courtney and Alexander. And just as a reminder, Courtney is the Overdose Prevention Program Manager with the Oregon Health Authority, and Alexander is the Drug Education and Overdose Prevention Coordinator with Lane County Public Health. Thank you both for agreeing to be here and participate in this Q&A. And I know you've touched on a lot already about your work, but this is going to allow us to do a bit of a deeper dive. So let's get started. I have a question for you first, Courtney. Could you provide an overview of the new strategies that Oregon is implementing to tackle opioid misuse amongst youth?
Yeah, thanks, Derek. And so I did already highlight some of kind of our larger strategies, going back to Save Lives Oregon, of course, and then also just doing kind of the data collection and exploring and surveying youth attitudes and beliefs and behaviors. I think that one highlight that I will provide some additional information on is through our state opioid settlement board, who made a $13 million allocation last year for primary prevention. OHA is kind of in the process now of administering those funds. And those funds are really intended to amplify Oregon's prevention workforce for prevention. And so we are expanding existing programs in all 36 counties, but then also certifying 100 more certified prevention specialists over the course of the next 2 years. And so we know that really an investment in the prevention workforce is an investment in communities and an investment in youth. And so again, just want to underscore, like, we have local prevention partners all across the state that they're educated, they're trained, they're ready to partner and work on youth initiatives, and they're really experts in this space. Another piece that I will highlight is I saw mention of the recovery schools when Colleen was doing this, but just for folks who aren't aware of recovery schools, there was a House bill in 2023, House Bill 2767, that established program requirements for recovery schools in Oregon. And so these schools are a space for youth who already are experiencing substance use disorder and co-occurring substance use and mental health issues to kind of like go to a safe place for recovery and support the recovery. And so over the course of, I believe, the next 5 years or so, we will have 9 more recovery schools in Oregon, which is a huge accomplishment for our state and something that's really unique and impactful. And then finally, I will also highlight that the Alcohol and Drug Policy Commission has formed a youth committee, and this committee is playing a very active role in working with the Alcohol and Drug Policy Commission to inform the 2026 through 2030 strategic plan. And this strategic plan is a plan that all state agencies follow when implementing substance use related initiatives. And so to be having that such a large youth voice in this planning is just really amazing to see. And so there's a lot of really exciting stuff happening in this space.
Thank you, Courtney. And I guess to start with you, Alexander, can you tell us more about the role of the Lane County Health Department in addressing opioid use, specifically regarding fentanyl education and overdose prevention?
Sure. So as I highlighted in the campaign, which we wanted something tangible to reach out to schools with, at first we really leveraged what we already had as relationship with schools. A lot of Lane County public health and prevention programming really already had some really great connections with some of our districts, with some of our specific schools, with our special district. And so we leveraged those connections and sort of started to ask, what do people need? And really what we learned is that no one had anything around fentanyl education in place. And what ODE came with was is more recent. So we're looking back about 2 years ago when we knew we needed to develop something for the schools on behalf of public health. And what really we led with was basically saying, we can have these conversations in the community, which a lot of schools had hesitancy around. There's a political element, there's a cultural element to this, there's stigma related to it. And really, I think what we approached them with was said, well, we'll do it. We'll just do it with you. And if things start to be complicated, we can put this on public health. And that's how I approached a lot of our schools, was to really offer them that out. And so for the schools, that were weary of starting to talk about having naloxone on hand, to start about talking about naloxone with young people or fentanyl overdose or counterfeit pills. We really went in with a public health voice. And the campaign enabled us to sort of just hand something off, a product that some schools could implement in their own way, in their own time, and still point back to the public health voice that we led with.
Okay, Alexander, thank you. And I kind of have a follow-up question that I think is good to build off of based on the answer you just gave. So how have your experiences kind of shaped how you approach building these partnerships? Like, has your approach, has it evolved with time? Were there lessons learned that you took forward with you?
I think it varied. You know, our county is large with very different types of school districts and communities out to the coast and our rural areas, as well as our more metro area. And so we really kind of molded things to the needs of those specific locations and schools and communities. I would say over time, luckily, things at the national level and at the state of Oregon level have also progressed. And so everyone has this on their radar now. I think we were definitely pioneering that and making sure people were getting it on their radar early. And now I feel confident that there aren't any schools that have not started to find a version of having this conversation with the community. We also know that as much as you can implement on large scale, like a curriculum, like a statewide message really comes alive when you can actually be in person and sit with the community in front of folks and just answer questions that people have. Lots of people have a lot of questions and misunderstandings around this topic. And so that's where I think things have really thrived, is when we're able to just sit in the space and talk through it with folks.
Thank you. So it sounds like a key part of this is directly engaging, being able to answer questions in real time. Thank you for those answers, Alexander. Courtney, I have another question for you, and I think that many people in our audience are going to be very interested in your answer. What training and resources are currently available for educators to help them address opioid prevention in their classrooms?
Yeah, thanks, Derek. I do want to just go back to that fentanyl toolkit for schools. And I know that
Hmm.
toolkits are maybe not the most like exciting things to direct people to, but this is the second iteration of the toolkit. It has been a very close collaboration between OHA and ODE. And I think that it's a toolkit that contains a lot of links to different types of resources, whether it's like public information in public campaigns, webinars, continued learning in this space. And so if you're not familiar with this resource, I do really encourage you to check it out because I know that I may be biased, but I think it's really excellent. I do think too that probably most of the folks in this room are probably already aware of the new curriculum standards that were implemented for the 2024-2025 school year related to Oregon's Good Samaritan Law and also just fentanyl in general. And so that was a collaboration between OHA and ODE. We collaborated very closely with them. And so school districts, I believe it's 7th grade and up, are now required to implement this new fentanyl related curriculum. And I will say too, I know I keep on emphasizing this, but we acknowledge that it can be a little awkward for educators to potentially be talking to their students about these topics if they're not feeling well informed themselves. And so just really want to encourage that there are folks at that county level who are just really wanting and excited to come into classrooms and implement that new required curriculum on your behalf. Talk about other topics. I know that there is a lot of convergence now between just substance use in general. So coming and talking about tobacco prevention while you're talking about other substances, alcohol prevention, and opioid prevention. And so just kind of really tapping into those local networks as well, especially if there is a certain level of discomfort or just like not being sure about implementing these at that educator level.
Thank you, Courtney. And I think that some of the resources we're sharing through our Linktree resource will also direct educators to some of these resources you've mentioned. And thank you for bringing up the toolkit. So that leads me to my next question for Alexander. Alexander, can you elaborate on the school-based toolkit that you developed and how it has been received by educators and the community?
Yeah, and the toolkit I gave you a little preview of earlier, and then I can discuss. It's different in that it's a toolkit that's about public messaging, right? It's specific to that, different than the OHA ODE toolkit, which is a very comprehensive set of supports for schools to operate. We really wanted to make sure that schools didn't have anything to deter them or slow them down in just messaging to parents, to students, to the broader community. So our toolkit was a variety of different templates and options, mostly of what schools told us would be useful. So things like a template letter to families saying, hey, here's this thing happening, and this is what we're doing in our school. We're letting folks know that we have naloxone in our first aid kits at our schools. The campaign that we promoted, that I shared some materials of earlier. Also, we had a mini version that really was something that a school could plug and play a set of posts. Nothing too elaborate, something that they could say, hey, this week we're going to put this through our social media channels as well. And the toolkit included a lesson, really not curriculum. We're not coming from education, but really a public health presentation that teachers or myself or other folks working in schools could implement that in that school setting. As well as I mentioned, a lot of print materials. We really wanted professional and well-designed materials to be available for folks. So the posters and the flyers and the stickers and all of those things were things we made available to anyone that wanted to partner with us.
Thank you, Alexander, and thank you also for making that distinction as well. Courtney, can you talk, well, how are current OHA strategies to fight opioid use being communicated to educators in school districts? So could you talk about how that message is communicated, how that information is communicated?
Yeah, absolutely. So, just kind of given that we are a state agency, we usually just communicate directly with other state agencies and let them kind of like filter those messages down to like their partners. And so, like I've mentioned, we have a really close collaboration right now with the Oregon Department of Education. Alana is new in her position and has really been being like a wonderful liaison between our two agencies and really helping kind of like coordinate not only our strategies, but our communications with schools and with educators. And so that's kind of typically the way that state agencies work is so we communicate with ODE and then ODE communicates with school districts and educators. However, in saying that, we also within OHA kind of do that similar communication with our partners working in similar spaces. And so within the public health division, which is where I sit, we have a really close relationship with our local public health authorities across Oregon. Alexander and I have worked very closely together in the past. And so it's kind of like communicating across and then also communicating down and then letting those kind of like local partnerships kind of like communicate and support each other. Oh, and one more thing that I wanted to mention too is that our program did recently launch what we call the Substance Use and Overdose Continuum Dashboard. And so this is a kind of like smart sheet dashboard that folks can go to. We're updating it like almost every day with additional resources and information. You can access that dashboard through our local prevention partners webpage that we highlighted. And if you are wanting to learn more about substance use related topics, it has resources, it has trainings, it has tools, information about upcoming events, and you can sign up to that through our local prevention partners webpage.
Thank you for sharing a new resource. And you said it's updated daily and it is public facing, so educators can access it. Thank you. Alexander, how do you ensure that your educational and harm reduction materials are effectively communicated to schools without causing concern among parents in the school community? And this is definitely a question that we have gotten in some of the past webinars from educators to be addressed. So
yeah, I do. I hear that. We didn't have a lot of time. No one has a lot of time to do this work. And what I really mean is there was no time to lose in getting something out there. So we really did move forward without what would be ideal, like a long bunch of research and focus groups. But that wasn't going to happen fast enough for us. And so nor were there resources to do that. So we moved forward with content while at the same time continued to share it with both teachers and administrators along the way for input and feedback. We had several kind of more informal conversations with young folks. Here at Lane County, we have a youth advisory council, so we were able to talk with young folks about it along the way, see what they thought about the product as we kind of moved forward along that way. When you say things around harm reduction and overdose prevention that might spark people's nervousness or controversy. We really are evidence-based, right? And nothing we did isn't an evidence-based piece. We know that education is important. We know that there is nothing to support the idea that talking about naloxone causes people to start using drugs, right? Those myths are, for us, not strong enough to deter us, right? While some people might still have those beliefs, we really needed to use that public health voice and say that we're here because otherwise lives could be lost. And there wasn't much more that we could really just lean on that as the key guide for us.
Thank you, Alexander. Did you find that there was a lot of concern amongst parents when you started to
And
distribute
so,
resources? And
right.
I'm
And
sorry.
so in fact, we thought, well, I was telling school administrators, if anyone's got a problem, send them to me, right? We'll take it on because we didn't want our school boards and our school leadership to feel that they were going to have to deal with those types of consequences with parents or community members. I've seen zero amount of pushback from that I'm aware of. Of course, social media has its folks on there that have weird and unkind things to say. But aside from that, in the sort of non-social media sector, we did not. We only were received with a lot of appreciation for finally having a conversation be sparked.
Thank you. Courtney, how do programs through OHA for opioid misuse engage students in prevention efforts? And could you share, or are there strategies that are most effective in capturing youth and student attention?
Yeah, thanks, Derek. So, as I mentioned, I do think that the survey that we recently did, even though that's not like a high level of engagement, it was a very broad engagement with over 900 participants, either completing a survey or doing an in-depth interview. And so that was extremely informative. And then also just kind of going back to the information that I shared about our Youth Advisory Council, that's really another strategy that we use to engage youth. You know, as a state agency, we don't have as much kind of like direct engagement as the community level folks do. But I can share that a lot of the things that we've learned through that engagement is very much in alignment with some of the information that Alexander has shared today. I think that some of the aha moments that I took away from our youth survey and interviews is that really so specific to educators, that educators are really like trusted resources for sharing information, but maybe not so trusted to go to if students are seeking information or have concerns or have questions. There's just a lot of fear around getting in trouble. And so really what we found in those surveys is that clinical and healthcare providers, and then also public health partners. So individuals like Alexander are really seen as trusted resources to not only receive information, but to go and like access information and ask follow-up questions and connect with resources. And so I think that that was a really great highlight. And then also what we've learned through this engagement too is just really learning more about messaging and what messaging is effective. I heard Alexander saying earlier that the fear-based messaging, one pill can kill, that isn't really something that youth receive well. What is more effective is, hey, this is a risk. This is how you can protect yourself. And then most importantly, this is how you can protect your friends. And I think that protecting your friends is something that really resonates with youth as well, is because that's what people care about a lot, especially at that age, is their friends. And so just kind of learning that type of stuff has been really impactful in how we are approaching our messaging and our strategies moving forward.
Thank you, Courtney. And do you find that it's really important to kind of amplify the voices of the youth as well?
Oh, yeah, absolutely. Of course. Yeah. And our youth advisory council is absolutely amazing. I wish that I was connecting with them more, and everybody wants to engage them because they have just been such an incredible resource for our agency.
Thank you, Courtney. So
Mhm.
the next two questions I have, I'm going to start with you, Alexander, but it's going to be very similar for you as well, Courtney. This is going to be about relationship building. Um, so Alexander, what strategies have proven successful in nurturing organic relationships between public health initiatives and schools in Lane County? And you've definitely touched on it before, but could you kind of dive back in?
Yeah, I think what I said before and really relied on is at the start of any kind of new relationship, new program, new topic area is to leverage the relationships that exist. So that's where we started. I was new to the role four-ish years ago, and said I just need to sort of see where we already have connections, and that's the starting point. And then what comes next is really fostering the relationship, offering resources is really great. Anyone will take free stuff, right? Free things that will help folks have conversation and get things in the classroom or get things in front of parents in schools. And also, we didn't ask much of schools. We really said, we're here to do this with you in the way that fits, right? So we weren't requiring schools to do anything new. We weren't asking them to offer a parent-teacher event, but when they were doing so anyway, we said, well, we can come and we can talk and we can be there. And so that I think was really welcomed. And lastly, and there's a lot of school affiliated folks on this call, and we all know that folks are busy. So what really needed to happen also was a lot of follow-up, like, hey, we're still here, hey, we're still doing this, and hey, we still have resources. And so a lot of that just takes a good amount of continuing to keep the conversation going.
Thank you. And similar for you, Courtney, how can educators collaborate with community-based organizations to enhance opioid prevention efforts in schools?
Yeah, I feel like this has been I've been underscoring this a lot and emphasizing this a lot, but I think that just kind of like knowing what resources are available to you is really kind of like the first step. And then like if those partners aren't already reaching out, kind of like reaching out to them to make those connections. There are so many preventionists in communities that are very eager to connect the schools and collaborate with them. And I've realized that I've gone this whole time without specifically calling out the local partners and who they are. And so within Oregon Health Authority, we fund what we call regional overdose prevention coordinators. There's 11 of them covering 22 counties across the state. Alexander is one of them. The other program that I've been referring to is the Alcohol and Other Drug Prevention Education Program. And so ADPEP, alcohol and other drug education prevention, and overdose prevention coordinators, those are really the folks that you should be looking to for prevention education in schools. And so working with them, inviting them to schools to either train staff or to connect with students, can't underscore the importance of that enough.
Thank you, Courtney. So we're definitely coming up on time, but I want to maybe try to get one question in to each of you, and then we'll cover a few questions we have from the audience. One question for you, Alexander, is, and I think that a lot of folks on this call will appreciate your answer. So what lessons have you learned from Lane County's approach to opioid prevention that could be valuable to other counties in Oregon? So what lessons have you learned that you could share with other counties?
I think what I touched upon is some of the lessons, right? The relationship building is crucial. Approaching schools or communities, telling them that they need to do something. It's not a way to do it, right? We didn't do that. So we knew that we needed to really meet people where they're at and be able to be a resource and a fallback for folks to do that. And really, it's been kind of, there has been a lot of coordination at this point in which most of what we were doing and the state and other counties have aligned. And so we're at a good point now because everyone really does feel like they have the same message coming to them. And so, yeah, I don't know if there's any major lessons other than we had to be persistent and be sure that this conversation wasn't going to be ignored.
Thank you. So persistence in meeting folks where they're at.
Yes.
Thank you, Alexander. And Courtney, what are some of the biggest challenges faced by opioid prevention programs in the state? So what are some of the biggest challenges that folks are going to face?
Yeah, I mean, I think just kind of going back to how I kicked things off, I think the biggest challenge is just how complicated of an issue it is. The overdose crisis that we are seeing right now, it's not just a substance use crisis, it's an economic crisis, it's a mental health crisis, it's a housing crisis, it's a healthcare crisis. All of these things are really interrelated and connected, and that's really kind of why we are trying to implement a systems level approach across different sectors, and then across that substance use continuum that I discussed, is because it's going to take like very big, like systems level changes to implement it, but we can do like small things to help move the needle on that. And another challenge that I just want to really emphasize is that stigma is still really prevalent, and we know that it is really damaging in terms of people being able to access information and access resources that can be life-saving to them, in terms of them being able to access treatment as well. And so I think that that is another thing that I can't emphasize enough, is that we need to really work together to destigmatize this so that we are kind of addressing this in a holistic and equitable way.
Thank you, Courtney. So we have a few minutes left, and I just want to try to get through one or two of the audience questions. So the first question is mostly about the overdose reversal kits, and this is for you, Courtney, or Alexander, whomever knows. How many overdose reversal kits can a school receive?
Yes. So, like I said, this is a program that's managed within our behavioral health division. The last I heard is that schools can access 3 kits right now, and within each of those kits, there are 8 doses of naloxone. And so that's just kind of like I said, the last that I heard. So things may have changed since then, but it's 3.
Thank you.
Mhm.
Another question, this one is for you, Courtney. It's about the dashboard. So this attendee wants to know about usage of the dashboards, like whether or not you guys are collecting information about who is using the dashboard, who it might be most useful for. And they also want to know how are you marketing? How is OHA marketing the dashboard for wider public use?
Yeah, thanks for that question. So I would say as of now, it's mostly our local public health partners that are using it and accessing it, and any other types of community partners that are interested in just learning more of what's happening on the ground in their community in terms of overdose trends. The way that we are publicizing it is again like on our OHA web pages, but we just did a press release last week within OHA talking about how it's great news. We're starting to see declines in overdose deaths in Oregon, and the dashboard was highlighted in that press release. And so it's a lot of encouraging partners that we already have showing up to these spaces, and then also publicizing it to the public.
Thanks, Courtney. This is also a question about the evaluation survey of youth. Someone just was curious about whether that information and the results, were available. You don't need to share them now, but if they're like available on the website that they can access, or something that we can share in our post-webinar email to everybody.
Yeah, so they will be available soon. So TBD. And it'll be available on our local partners page.
Okay. And I want to thank you both, because we're coming up on time, for participating in this Q&A and for sharing your experiences and your knowledge in this space and all the work that you've done. It's been really helpful for us to be able to discuss that and share that with educators in Oregon. Having said that, I'm going to pass this off to Yessie.
Thank you so much. To all of our amazing presenters today, it was such a great session. And as I mentioned in the beginning, this was part of a series of virtual sessions. So the last one will be, as you see on the screen, on May 28th. And the topic is What's New in Oregon, School Lesson Planning, Public Information Campaign, and Learning Opportunities. So we invite you to register for that last session using the QR code you see on the screen. And then lastly, we first of all want to thank you all for being here today, this afternoon, and we really value feedback. So we ask you to please complete our follow-up survey that my colleague put in the chat. And other than that, thank you everyone, and I hope you have a great day, and we really appreciate your attendance to the webinar today.